My name is John Duffy. I'm the Senior Stroke Consultant at Hampshire Hospitals, and I've worked in stroke medicine now for about 20 years.
Dr Duffy, I wonder if you could tell us about the causes of stroke.
Most people, when they think about it, know the risk factors for stroke. There are some obscure ones, which we will talk about, but the commonest risk factors are blood pressure and cholesterol. Obviously, high blood pressure is an important risk factor, and you should have screening for blood pressure regularly throughout your life. Your cholesterol is also an important risk factor. What people don't realise about cholesterol is it's not just about the diet that you eat, it's also about what your body produces naturally. And so commonly it will be important to have your cholesterol levels checked by your GP, certainly when you're over the age of 40. Other than that, we have things like lifestyle, things like like smoking and cholesterol and diet, alcohol, the amount of exercise you do, the amount of weight gain you have. But one of the particularly important risk factors, particularly when it comes to severe disabling strokes and strokes with a high death rate, is atrial fibrillation. Atrial fibrillation is a condition that frequently patients aren't aware they have, and it's where your heart is an irregular beat rather than a regular beat. And when your heart beats irregularly, what's happening inside your heart is that two of the chambers, called the atria, aren't contracting properly. And what happens is the blood within the heart tends to cycle rather than pump through the heart. And as a result of the cycling of the blood, you get blood clots forming, and that can cause strokes.
Can you tell us some of the symptoms of stroke that you might get from AF?
Patients will frequently be aware of their heartbeat, and that feels like an extra banging in the chest, perhaps when you're not expecting it to be. Normally we're not aware of our heart rate, but with atrial fibrillation patients commonly are aware of their heart rate, particularly on exertion, and that doesn't have to be heavy exertion. The other thing about your heart rate when you're feeling it is the power of the beat changes, but also the regularity of the beat changes, so you end up with a very irregular pulse and a very irregular heartbeat. In addition to that, you may find that you're just tired, more tired, and experience lethargy. Frequently patients will complain of breathlessness, particularly related to exertion, and they'll be the most common symptoms that patients will complain about.
So what's it important that we do to prevent strokes from AF?
Because it's difficult to identify as a patient whether you have it, it's important that we have a good screening programme, and this generally sits within primary care. If you're a patient and you have ever experienced extra heartbeats, it's important that you go to your GP surgery and have either see the practice nurse or the GP and have your pulse taken. It's a very simple test. It's just taken by feeling here on your wrist, and you can feel whether the heart's beating regularly or irregularly. If the heart's beating irregularly, then it will be important for the nurse or doctor to perform an ECG, and that can easily diagnose what's going on. If you haven't got any of the symptoms I mentioned before, breathlessness, palpitations, and just general tiredness, then it's important that whenever you go to your GP, particularly over the age of 40, that your heart rate is just tested through a simple pulse test. And that is a reliable way of indicating whether somebody has or could be suspected of having atrial fibrillation.
Once you know that you've got atrial fibrillation, what's going to help you not have a stroke?
The depressing statistics when it comes to atrial fibrillation are that 1 in 5 strokes are caused by atrial fibrillation, and atrial fibrillation tends to cause more disabling strokes and is associated with a higher death rate. So it's very important to prevent. Now, as I've already stated, it's very easy to screen for atrial fibrillation, and once we've diagnosed it, The really positive thing is that there are treatments around now that can successfully treat atrial fibrillation, not necessarily stopping your heart from fibrillating, but preventing the side effect of these blood clots forming within the heart. And that treatment people will be familiar with is warfarin, but there are now newer agents that can be given which are equally effective as warfarin in preventing the strokes from occurring.